Well, the mission statement of coastal jaw surgery in a nutshell is to provide excellent care, excellent surgical care for our entire patient family in a very safe, efficient, and compassionate manner. We strive to provide our patient family with a very seamless approach for their entire surgical experience. Our bottom line desire is to improve our patients' quality of life, and we promote the most important promise of all, and that is that we care. The spectrum of what we do encompasses the entire range of an oral surgical practice in terms of what is basically office-based surgery, and that includes bone grafting, that includes soft tissue grafting, and specifically periodontal plastic surgical procedures, which virtually 98+% of all oral surgical practices don't offer. We consider ourselves more or less hybrid surgeons in that respect, so it makes us very unique. We're also very adept at performing anesthetic techniques. We can provide our patients a very comfortable experience because of the range of anesthetic training that we have within the scope of oral and maxillofacial surgery. We keep up with virtually everything that could possibly impact what we do in a positive manner for our patients. I think what's even more important is the combination of that with the compassionate, caring mode that we do this in. So between the skill sets of our doctors and the compassionate element that we have, we create what we feel is a very seamless experience for our patients from the time they first contact us all the way through their entire experience. I think our patients can fully expect that we will evaluate them and treat them in such a manner that they will feel like they're the only person we'll ever see in our practice. Each patient that we see, we spend ample time with, such that we're able to evaluate them not just clinically, in other words, what's in their mouth, what their problem is, but we try to get to know them a little bit right off the bat so that ultimately we can customize the treatment for them in such a way that it fulfills their needs, not just orally, but psychologically and emotionally as well. We're not just treating the mouth, we're basically treating the entire being. Our staff plays a very critical role with regard to allowing our patients to be comfortable right from the beginning. And in fact, they're that first point of contact, and our ladies do a tremendous job with regard to handling patients in terms of their concerns from a financial perspective right off the bat. They may have some questions before they even see us in the evaluation rooms. And right through the back with our assistants, our surgical assistants, they are all well trained. And in fact, our staff, we pride ourselves on really making sure that the people we have not just good people skills, but really care. I think if I needed to convey in some way or form to every patient that would come and see me, I would want my patients to know that I look at them as family. I thoroughly love what I do. I certainly have avocations, and most importantly, my God, my family, and then my practice in that order is the order of my priorities. I'm very passionate about my work. Not only do I truly love the work that I do, I love my patients first and foremost, and that is something that I found easy to do growing up in a very strong ethnic, family-based background and upbringing. Being of Greek ancestry, I think that really made such a difference, having the influence of my grandparents and parents. We all lived in one house for the first 10 years of my life, so that impacted me significantly. The high technology element, sure, but more so is the compassionate element that I was raised with and is part of me. So you combine those two together, and to me, that's the formula of not just say the word success, but of basically making my work my play, because it's really not work. It never has been. I thoroughly love what I do.